Nick, you come in high and
I stopped smoking. I don't smoke.
you sure? All right,
I'm that guy. Stop smoking.
that's good. How long you been clean? Yeah, from everything. Now that you're saying from weed. Sorry.
Hey, and just an FYI, we can hear everything that's going on.
Sorry, I was talking to one of the youth.
everyone. People are starting to pop in here, so we still have several minutes before it starts. I see our guest speaker is on here. Hi, Sandy.
Hello. Can you guys hear me okay?
Yes.
Okay, awesome.
So we will wait several more minutes, and then we will go ahead and get started. All right, everybody. I'm hoping you can all hear me okay. Welcome to Transition Tuesdays. Good afternoon. This Transition Tuesdays is presented to you by the St. Louis Youth Interagency Partnership. My name is Amy Sickerman, and I am the Director of Youth Services for Vocational Rehabilitation. And this partnership is a group of agencies that work with youth in St. Louis City and County and beyond a little bit. We were originally formed to build a stronger connection between agencies, and we kind of help develop trainings every year to help teachers and agency staff learn about different resources and topics, and as well as gain contacts for these resources and agencies so we can work better together. If you ever have any information about the team or have any questions, you can always email me, and I will put my email in the chat. But welcome to the first session of our fourth annual Transition Tuesdays webinar series. Just some housekeeping. Please keep yourself muted until we have questions so that everybody can hear. You can always put your questions in the chat box and we can ask those out. Bear with me because Teams is if you need a certificate of attendance, you can put your email or name in the chat so we can make sure to get that to you. It'll be sent to you if you're attending this live, and I'm trying to record this to put it on our webinar series page on YouTube. But today's topic is a big one. I keep hearing questions about this and we hear rumors. So I'm hoping that our guest speaker will be able to dispel some of these things and tell us the real deal about DMH waivers and all sorts of things like that. Our presenter today is Sandy Kaiser. Sandy has been working for the Division of Developmental Disability since 2004. She started out as a support coordinator in the St. Louis area, where she helped transition age youth and their families connect with needed services and supports. In 2012, she transitioned into the Employment First Specialist role, referred to at that time as the Youth Transition Employment Resource Coordinator. Her focus since then has been on helping others learn more about services, supports, and best practices that allow more individuals the opportunity to explore, prepare for, obtain, and maintain competitive integrated employment. In 2013, she obtained her expertise as a benefit specialist, which allows her to help individuals and families navigate work and benefit concerns. She is now using that expertise to build capacity in Missouri for more professionals to help address these concerns and minimize unintended misinformation. In 2023, she was nominated as a board member to Missouri's APSE, where she works with other board members to plan and host APSE Missouri events. So we are happy to welcome Sandy Kaiser.
All right, thank you so much. And just a shameless plug right now for APSE Missouri. So on the 15th of this month, we have a free virtual event available. We are going to have Susie Stefaniak from Missouri's Office of Administration talking about all the things the state of Missouri is doing as Missouri as a model employer. So all of those activities that we're working together on. And then we have Nicholas Holtz and Cassidy Job talking about city as a model employer. So they're going to be talking about what's been going on in Kansas City as Kansas City as a model employer efforts. So we'll have those three guest speakers kind of talking to us about those efforts and giving us some tips and strategies on things that we can be doing to take advantage of those efforts. So something for you guys to put on your calendar, October 15th. That's my shameless plug for APSE. So jumping in today, I do have a PowerPoint, but I do notice that a lot of you already are somewhat familiar with the division, either as being a support coordinator or being a service provider. So I don't want to bore everyone with a PowerPoint that's really geared towards individuals who may not have hardly any knowledge about the division or knows very little. However, knowing that we do have some individuals that are outside of support coordination or service providers, there might be a good number of you that are like, no, we want to see the PowerPoint. So I'm going to leave it up to you guys. How do you want me to get through this? Do you want the PowerPoint, or do you want us to just have a kind of open and answer session?
I'm hearing PowerPoint.
Okay. I'm seeing right now the votes are coming in the PowerPoint. Okay, so I'm going to go ahead and share this PowerPoint. Note that this was a PowerPoint that was created between myself and another TCM provider. So TCM refers to Targeted Case Management Provider. So in the state of Missouri, we do have some state employees that provide those case management supports, but in a lot of other parts of the state, we kind of contract out to a private entity that we call a Targeted Case Management Provider. So this was a PowerPoint that was developed for a workshop in the Kansas City area. So the Targeted Case Management Provider that partnered with me on developing this is out of the Kansas City area. So I want to give credit to where credit is due. So some of these slides were created by her. The ones that I'm going to focus on are mostly going to be the ones that I created though. So let me share this and we'll just kind of go through this. If I can find my mouse. There we go. Okay, so hopefully you are now seeing a PowerPoint slide deck, correct?
Yes, we see like the preview option.
Okay. Let's see if I can do it this way. There, is that better?
Yes, perfect.
Okay. All right. So basically with this presentation that was created, it's called a What's Next workshop. And the target audience is basically families of transition age youth. So we're kind of focusing on you're getting close to getting out of high school. Now, what do you need to do? So one slide I will kind of focus on that the other person created kind of frames that discussion. You're almost 18. Now, what do you need to do? And a lot of this is in relationship to how do I get connected with services and supports I'm going to need once I'm out of school. So kind of, well, yeah, you might need to apply for Medicaid. You might need to apply for Social Security benefits. You might need to apply to the Division of Developmental Disabilities so that you can get a support coordinator and start identifying what those support needs are. So one of the tips that we wanted to give. So if you're wondering, how do I apply for Social Security? What do I do? So that link that takes you to ssa.gov/apply kind of provides you with here's some steps you need to take. This is how you do it. On the division's website, dmh.mo.gov, we have some tips for applying for Medicaid. So if you go to dmh.mo.gov, and on the top of the screen, there's like a ribbon that will say crisis, behavioral health, developmental disabilities. And over on the far right is programs. You want to click on programs, and then you will see a kind of light gray box on the right side that has applying for Medicaid. And you can click on that applying for Medicaid, and that will take you to that web page that provides you with the tips of what do I need to do? What are the steps? How do I do this? Is it online? Is it in person? What are some things I need to know? And then, of course, with navigating Division of Developmental Disabilities and how do we apply for services and supports through the division, you can go to dmh.mo.gov. And again, at the top, that ribbon, you will want to click on developmental disabilities this time. And then down towards the bottom of your screen will be a little green box that says for individuals and families. And clicking on that will take you to the part of our web page or our website that talks about how do I apply for services? What does that look like? That process that families may need to go through. So what is the criteria for case management? So division eligibility. So this has pretty much been the same as it always been. So you have to have what we consider a developmental disability. So that can be an intellectual disability, cognitive impairment. That can be a physical type of disability. So quadriplegia, cerebral palsy, which is also neurological, spina bifida, It could be a sensory impairment type of disability. So hearing impairment, vision impairment, autism could fit in there, epilepsy. So the thing to note, we make a distinction between those disabilities that are primarily psychiatric in nature versus developmental disability. So if somebody has, say, ADHD or bipolar, those are going to be considered psychiatric and would be best served by our behavioral health side, wouldn't necessarily qualify you for developmental disability. So again, we're looking at intellectual or developmental disability. The intellectual disability had to have been occurring prior to the age of 18. So the developmental disability has to have presented itself prior to the age of 22. The other piece on that is that individuals need to have a lifelong need for specialized coordination and support. So again, we're looking at kind of a long-term, this is a long-term issue that you need help and support with. It's not, hey, I just need help for the next 6 weeks and then I'm done. You've also got to have functional limitations. So for support coordination, all you have to do is have functional limitations in 2 areas of major life activity. So this visual kind of breaks it down by age limits. So birth to 4, you may not have a documented developmental disability other than young child with a disability. So if you're participating in first steps or just starting to get into preschool and you just have that diagnosis of young child with a disability, that can qualify you for division of DD. As far as the functional limitations, it used to be we would look at the Vineland, and for adults, we would use the MCABI, the Missouri Critical Adaptive Behavior Inventory. We have replaced those with the MOS. However, just noting that if somebody has a valid Vineland, we might be able to use that instead of the MOS to establish eligibility. So it's not that we will only use the MOS. We can use other assessments as long as they are standardized, comprehensive, norm referenced, and psychometrically sound adaptive functioning assessments. So the Vineland meets that criteria. So we can use the Vineland if somebody already has a Vineland completed. So then children ages 5 to 17, again, we're looking at they have that developmental disability, either identified through a diagnosis that was done by the school, or that a doctor has diagnosed them, and we have that doctor's diagnosis. So with the functional limitations, looks at that they have a score of at least 87% below average in 2 major life activities on the Missouri Adaptive Ability Scale, the MOS, or at least 95% below average in 1 major life activity on the MOS. And then adults scoring at least 95% below average in 2 major life activities on the MOS, the Missouri Adaptive Ability Scale. So what changed in 2018 is that if an individual didn't have Medicaid, they might no longer be assigned to a support coordinator. So what What you'll notice here is in white, these are the counties that do not provide support coordination to individuals without Medicaid. So if individuals don't have Medicaid in one of these counties, more often than not, they're going to be assigned to a state information. Well, they won't be assigned. They'll be kind of in the bucket of information coordination. They won't have anyone assigned to them. They'll just kind of be in that information coordination, which we are, I think, in the process of renaming to resource and referral. But it's basically, they're in that information specialist realm. So they're not assigned a specific person, but they can get questions answered. They can get help from that information specialist team. So the counties in the blue have said that they are willing to provide that support to individuals without Medicaid. So for the counties in blue, you may possibly be assigned a support coordinator to help you navigate things. So then looking at what that process looks like when someone contacts the regional office and wants to open up a case. So it first starts with one contacting the regional office that serves the county that the person lives in. Then there's going to be an initial interview or a screening per se. So that individual is going to speak with somebody from the intake team who is then going to ask some questions, kind of determine whether somebody is likely to be eligible or not likely to be eligible. So an example of this is if we get a call from somebody that has, like I said, that ADHD diagnosis. And that's the only diagnosis that they have, ADHD. They don't have any other, they don't have like autism or cognitive impairment or a physical limitation like quadriplegia or spina bifida or anything like that. So it's just ADHD. During that initial interview, the intake staff person might be saying, "Ooh, it doesn't seem like you would meet our eligibility because of the diagnosis piece." So at that point, that person could be determined ineligible and would then be referred to other agencies. However, let's say that person with ADHD does have something else. Let's say they have a cognitive impairment as well. So now with that piece, that could possibly make them eligible for us. So again, kind of hearing that, oh, you got a cognitive impairment too? All right, potential eligibility. So then they're going to move forward. And then the next step is completing that actual application. So they'll complete the application. Records will be requested and reviewed. And then based on that, if assessments need to be done, like if we need to do a MOS, we'll be able to schedule that MOS, get that done. And then from there, that's where the eligibility determination will happen. So if somebody meets all the criteria, then they are referred on to support coordination or information specialists based on whether or not they have Medicaid. So if they have Medicaid, you move on to support coordination. If you don't have Medicaid, then we look at, oh, wait a minute, does that county still provide kind of that assistance for individuals without Medicaid, or are you being served by the information specialist team? And then, of course, if it's determined that the person's ineligible, they will be provided their right to appeal and will be referred to other agencies. So, like I said earlier, where you go depends on what county you live in and what regional office serves that county. So, we have 6 or Yeah, 6 different regional offices and 5 different satellite offices. So you'll notice kind of like we've got them grouped by color. So in the yellow is Kansas City Regional Office and Albany Satellite Office. So the counties that are just north of the Kansas City area, you'll see it kind of divided by that black line. Those counties in yellow at the top part of the state, those are going to be served by Albany Satellite Office. Then those counties just under that black line that basically makes up that Kansas City area. So you got Plant, Clay, and Ray counties at the north of Kansas City area. So those counties would be served by Kansas City. In the green is Springfield and Joplin. So on the left side of the state, the left corner, that's going to be your Joplin regional office. And then just to the right of that is going to be the Springfield regional office. In the violet, the blue purple, that's Central Missouri and Kirksville. So Central Missouri is there in the middle. And then to the north of that is the Kirksville satellite office. In the light blue, we're going to have Hannibal satellite office, St. Louis, and St. Louis Tri-County regional offices. So Tri-County, St. Louis County, we all have one intake team. So whether you're in St. Charles, St. Louis, or Jefferson counties, you could contact either the Tri-County office or the county regional office, and you're still going to get directed to the same team. Hannibal, you would call Hannibal regional office, and then you would get directed to that team. So Sykeston, we've got Sykeston regional office. That is kind of like on the right corner of the state. So that little strip going down to the boot heel, that would be your Sykeston regional office. The southernmost in that kind of like purple, magenta color, that would be Poplar Bluff. And then going up kind of towards the middle of the state, directly under Central Missouri, that would be Rolla Regional Office. So these slides, again, created by the person that was partnering with me, kind of frames what should you be thinking about? What kinds of things is going to kind of start that conversation that you're going to have with a support coordinator? What are those goals that you have? What do you want to be doing with your life? So I'm going to kind of skip through some of these. So actually, I'm going to go back to this. So when somebody needs services and supports, how we usually provide that is through what we called waivered services. So a waiver is a program that provides services that allows individuals to remain in their homes or a community setting instead of an institution while maintaining or improving their quality of life. So again, looking at what somebody wants to achieve, what makes sense for their life, where they want to see themselves in 5 years, 10 years, that kind of thing. It's going to be like, ooh, what services and supports are going to be needed to help you achieve those goals, those outcomes. So the division has 4 available waivers. One is our Mo Children with Developmental Disabilities. This is commonly referred to as the Sarah Lopez waiver. This is for individuals under the age of 18 who aren't able to access Medicaid due to their parents' income or assets. So when somebody is not able to access Medicaid and they need those supports, we are sometimes able to get those services and supports for them under that Mo Children's with Developmental Disabilities waiver. The other three require that the person already has Medicaid to access. So the Partnership for Hope waiver, that is our newest waiver that has an annual limit of 12,362, but it can go up to a hard cap of 15,000. You just can't go over that 15,000. Community support waiver has a limit of 40,000. However, people often go over that limit. So it's not a, doesn't have like a hard limit like the Partnership for Hope waiver does. So it is possible to go over that 40,000 a year. The comprehensive waiver limit or comprehensive waiver has no annual limit. This is usually intended for individuals that need residential supports. So if somebody needs like employment services or a day program, but they're still living at home with their parents and they don't need to move out just yet because the parents are able to help support them, then chances are they would not get the comprehensive waiver, even if needing more than $40,000 of support a year. So that would probably still put them in the community support waiver. So we talked about the eligibility for getting support coordination. There's another layer of eligibility that is needed for waiver eligibility. So basically, with this in general, again, we're looking at that intellectual disability or developmental disability. So one thing to note, there are some developmental disabilities that you can qualify for case management services or that support coordination that you wouldn't be able to qualify for a waiver with. So one example is learning disabilities. So with learning disabilities, one could possibly qualify for that case management support, but not be eligible for a waiver. So we look for an intellectual disability or a developmental disability diagnosis that is considered waiver eligible diagnoses. The next piece, eligible for appropriate MoHealthNet Medicaid coverage. So with this, so a few years back, legislators, well, state of Missouri, we approved the Medicaid expansion, which now allows individuals that don't have access to other insurance and that meet income eligibility to access Medicaid. So typically when people first apply for Medicaid, they might be found eligible for Medicaid under that Medicaid expansion group. That'll allow you to access case management, but you won't be able to get waiver funding with that Medicaid. So individuals may have to apply for a different type of Medicaid or a different category of Medicaid so that they can qualify for waiver funding. The next piece is that you have to meet the intermediate care facility for individuals with intellectual disabilities level of care. So the ICF-ID level of care. So with this, individuals have to score at least 95% below average in 3 major life areas on that Missouri Adaptive Ability Scale. So we have to, so if you think to get support coordination, to get case management, you only have to have functional limitations in 2 areas of major life activity. Well, for waiver funding, it's 3 areas of major life activity. So there's increased criteria there. And then, of course, you have to have a need for a DD waivered service. So you must require at least 1 waiver service on a monthly basis every month. So This is just in general. Each waiver might have its own set of criteria that individuals have to meet. So you could meet these 4 sets of criteria, and then depending on the waiver you're needing, could have additional criteria. So again, just kind of going a little bit of detail, and this was created by the person who partnered with me for this presentation. So how do I get waiver? First, you got to have that Medicaid. You have to have a support coordinator. And then that support coordinator is going to help you navigate which waiver will best suit your needs. So that support coordinator will drive that process of getting you connected for any needed assessments, and will make sure that you're aware of the options available to you in your area and help you identify what provider may be a good fit. So, and then that support coordinator will put together a packet and submit it through our utilization review process for approval. So what services are available? Service and supports provided under waiver funding are intended to empower individuals and their families to experience quality and meaningful lives. So where they become valued members of the community, where they live, work, play, learn, and pursue their life goals. So you kind of think about it, it's like, what services and support can help individuals with some of those goals? And almost the sky's the limit. There's a lot of different services. So one thing to note, that there are some limits to waivered services. So typically, you will not see waivered services covering those typical living expenses. It's not going to cover one's rent, food, clothing, medical copays, that kind of stuff. All services must still be justified, and they go through the utilization review process. Ongoing services still must be approved on an annual basis. And then, of course, we have to adhere to our specific service definitions. So when you're requesting services and you're looking at, oh, I want this service, it's like, okay, is what's being provided, is what we're needing, what's being done, does that fit within that box, so to speak? So again, I'm going to skip through some of these. So I wanted to kind of specifically focus on employment a little bit, because again, as we think of those transition aged youth, they're getting out of high school, and the next logical step is, hey, you're either going on to college or you're getting a job, right? That's what most of us ended up doing. So again, looking at individuals with disabilities, it doesn't really matter whether or not we have a disability. The expectation for all of us is, as adults, you're going to get out there, you're going to get in the world, and you're going to support yourself. You're going to get a job. You're going to contribute. So that is an expectation for all of us, regardless of whether or not we have a disability. So back in 2011, the division created some employment services, knowing that we had a gap. So VR is a wonderful resource. They are the gurus when it comes to employment, but they can't serve everyone. There's some individuals that are still kind of falling through the cracks and not able to fully benefit from VR. So again, the division kind of looking at that going, okay, how can we help support individuals that need more support than what VR can provide? The ones, like I said, falling through the cracks. So that's where we came up with developing some employment services. they've gone through a little changes. So 2011, we had what we called job discovery, job preparation, and community employment. Those were the three services we developed back in 2011. 2016, we renamed a few of them and we added a new one. So job discovery became career planning. Job preparation became pre-vocational services. And then community employment became supported employment. And the new one that we added was job development. So before then, job development was part of community employment. We decided to kind of separate that because then we could track that a little bit better and be more targeted in our approach. So what this shows you, this little graphic kind of shows you that target, how we're being very targeted in our approach. So at the top, you've got that determining that the destination. That's career planning. That's when we're trying to figure out what makes sense for this person. What interests do they have? What skills do they have? What are those needed conditions that they might have to be happy and successful in employment? What does that look like? So that's that career planning. Of course, typically, once one's kind of figured out where they want to go, the next logical step is going to be getting that job, right? However, sometimes individuals may need to develop some more skills. So we have pre-vocational really designed to kind of help people scale up their workplace behaviors if that's needed for them to be more successful in employment. So that's not everybody has to go through pre-voc. It's there only if it's needed. Then, of course, you've got the getting the job, which is the job development. That's really kind of designed to help them find that job. And then, of course, on the left-hand side, you've got the learning and the maintaining the job. That's that support employment. What supports do they need to either acclimate to a new job or to keep maintaining their current employment? And in the middle is our newest service. This one, I want to say we developed in 2021, navigating work and benefits. So we know there was a lot of questions from individuals about how work impacts their benefits. There's a lot of fears out there. So that benefits planning is really designed to help somebody understand how work will impact their benefits, what rules they have to adhere to with their benefits, what their options are based on their benefits. So for example, we know that it's like if somebody has Social Security Disability Insurance, SSDI, basically they can earn up to the substantial gainful activity and they'll still be getting their cash benefit. But when they engage in substantial gainful activity, when they're earning at least that substantial gainful activity amount, then it becomes a thing of, oh, wait a minute. Now there's a possibility that their cash benefit, their Social Security benefit, could stop. For some individuals, that's okay. They're not really concerned about that cash benefit. They're more concerned about the health insurance coverage, or they're more insured about supports that they'll need to ensure that they're their most successful selves. Some individuals, it's like, oh, wait a minute, because of my disability, maybe I can't earn that much. So I can't work full time. That's not going to be a possibility for me. And I really do need to maintain that cash benefit so that I can be my most financially sufficient self. So again, it's kind of that personal dialogue, what's important to that person, and helping them understand what choices, what decisions they need to make, and how that works together. So again, with employment isn't an either or choice. So sometimes individuals may be only wanting to work part-time. And then the question is, okay, what additional services or supports can help contribute to that meaningful day? So what can round out your time so that you're feeling like, yeah, I'm keeping busy. I'm getting to engage in activities that I find valuable. Work is one piece of it, but so are these other activities that I do. And then, of course, sometimes we know that work may be more of a long-term goal rather than a right now goal. So I think of, again, kind of just our own personal journeys. Some of us coming out of high school may have decided to go on to college and didn't get a job right out of high school because, no, we're going to focus on college right now, and we're going to spend our time getting good grades in college, and we'll focus on the job a little bit later. So again, work doesn't have to be a right now goal. It could be kind of like that later down the road. What do we need to do first to get you set so that you will have a more successful employment outcome later on? And then again, I kind of mentioned earlier, there are a lot of different services that the division provide. So these are just some of the services that the division can fund. So individualized skills development. This can be very useful for individuals that, you know, want to be more independent, want to be able to manage their own daily activities. So that could be managing their own home. Like, I need to learn how to keep my home clean. I need to learn how to clean up my living quarters, make my bed, do laundry, that kind of stuff. It could be, I need to learn how to manage my finances. I want a job. I want to be able to control my money, but I need help learning how to create that balanced budget. And, how do I manage my finances so that I'm living within my means? So, individualized skill development could also be kind of using to help individuals learn transportation. So I can't drive, so I'm having to either use public transportation or I'm having to coordinate transportation. How do I do that? So that can all be done under that individualized skill development. Personal attendant. This could be like, all right, I need help performing activities, whether they're in my home or outside of my home. I need help with, this could be, I want to take a personal enrichment course. I want to take a course on knitting or pottery making, or even, computers. So I want to take a course on using Microsoft Word, but I'm going to need help to participate in that class. I'm going to need somebody helping me to maintain my focus during that community class. So this is where a personal attendant can help with that. This could also be, hey, I need help going to the grocery store. I need help with doing things within my own home. Community networking is for helping individuals connect with people and form those relationships out in their community. So an example of this could be, hey, I'm really interested in woodworking and I want to join a woodworking guild. So community networking can be used to kind of help somebody form relationships with others in that um, that network, that group, so that that person can be more independent, can be able to participate in those activities independently on their own. So dehabilitation works on developing just kind of habilitative type skills. So this can be helping somebody with working on communication, safety, interpersonal skills. So kind of like those community community rules, so to speak. So interaction, knowing how you interact with people you just met versus people that are acquaintances versus people that are friends. So learning all those different things. Benefits planning, I've already kind of talked about as one of our newest employment services, but it's really something that kind of relates and helps people in the employment journey. So kind of navigating those waters of how will benefit, how will work income impact my benefits? What choices can I make? How does it all work together? Just developing that game plan for, okay, this is what makes sense for me. Transportation, again, getting around from place to place. And then assistive technology. So again, helping individuals to be more independent. So how that assistive technology can help individuals with doing activities and belonging to their community. So, all righty. I'm going to stop sharing this and let's kind of get some questions going.
Guys, if you have questions, Sandra or Sandy, let us know.
I see a hand up. So Kathy, go ahead and jump in there. And if you're talking, you're on mute.
Maybe Kathy didn't mean to have her hand up.
I don't know.
Got a question.
Hey, Sandy, this is Casey Wisdom.
Hi, Casey.
Hey, how are you? Long time no see. Hey,
Yeah.
we're hearing that there is no waiver funding available. Is that accurate for a while now, it sounds like?
So addressing the big elephant in the room. So back in May, the legislators approved our budget. So this is done on an annual basis. So as you guys know, elected officials have to kind of match what's going out with what's coming into the state. So they have to create that balanced budget for the state to operate on. So the division had requested funding for what we call caseload growth. So basically, this would be individuals that don't yet have waiver funding, but may need waiver funding throughout the year. So we requested it. However, that finalized budget that got approved in May didn't include the caseload growth fund. So basically, we were given kind of enough money to cover what we were already funding and also fund certain emergency situations, but we really weren't given anything for just the person that comes into services and needs services. So to answer your question, that then has caused us to have to implement a wait list for new waivers. So if somebody already currently has a waiver slot, they're not going to be impacted by that. But if somebody didn't have a waiver slot, now they're coming up out of high school and say the team's thinking, oh, they're going to need day hab or they're going to need employment supports or maybe a combination of both. Those are the ones that are going to be impacted by that wait list. So does that answer your question, Casey?
Yeah, thanks, Sandy. And I'm assuming that will remain that way for the fiscal year.
So basically, yeah, that's what we're looking at. We're kind of bracing that the reality is, unless there's some kind of interim approval done and the legislators kind of release some funds and say, oh, we're going to give you, this much. Yeah, chances are it's not going to change until July of next year. So we'll probably know around May-ish. That's usually when they finalize the budget and we hear what's going to happen. So we expect to kind of see what happens then.
And then just one more follow-up to that, Sandy, and then I'll be done. Are support coordinators then able to offer some other suggestions in terms of resources to families who may be on the wait list?
So very good question. Yes, we are. Again, support coordinators might be limited by the resources they know about. But hopefully, yes, support coordinators are able to kind of help families navigate other possible funds. Is there county board funds? Are there grants, other resources available that individuals can tap into? I know when I did support coordination, sometimes you had to be very quite creative, and it may not have been a perfect fit for the family's needs. But hopefully it was able to touch some of the needs that the individual or the family had, and they could at least make some progress. But yeah, hopefully support coordinators will be able to help individuals navigate other resources as well. But just note that, again, like I said, support coordinators might be limited by their own knowledge of what's available, or even from community to community, we see differences in what's available and not available.
But I'm guessing, Sandy, they should still keep applying so that they go on that wait list.
Yeah, definitely. So the support coordinator is still going to kind of document the needs that the person has, and if waiver funding would be the best fit for that person, they're still going to request that service. So it'll still go through that process, and basically what will happen is then, once it gets approved, an individual will see a letter that basically says, hey, you've been approved, you're on the wait list.
Then you wait.
Yep, then the wait. So,
Janelle
but,
Barber,
like I
did you?
said,
Oh,
hopefully
sorry.
support coordinators are helping to identify other resources that individuals can tap into as well.
Somebody wants
So
to know if you have
Janelle,
any
I see
idea.
you've got your hand up. Do you have a question?
Yes, I have been hearing quite often in the last year when I have DMH along with VR at a staffing, that if we are recommending moving forward with supported employment job development, as it's called on the VR side, that after job supports, which is job coaching, ends, then DMH can come in and pick up with some of those services. That's what they're calling braided services. But they're not further explaining how that would work. So if, as a CRP, a community resource provider for VR, if we have finished our job supports, job coaching, what is it that DMH would be able to do in those braided services? I guess I'm wanting more deeper explanation of what that looks like.
Awesome. I love that question, Janelle. So, how we have our employment services designed. So you've got somebody that you're serving through VR funding and you're like going, okay, we're going to move into job development. We're going to get them a job, but they're going to need long-term ongoing supports. So in those communities that don't have kind of like that funding stream, they don't have county board funds that are being used for that ongoing retention piece, that ongoing supported employment piece. That's where we can request supported employment, which is one of our waivered services. We can do that supported employment, and we can request that while that person is still with VR. So before VR even closes the case, you've got that IPE developed. We can basically say, hey, we're gonna request up to 480 units of supported employment to provide that ongoing employment support once VR is no longer able to provide that. So I think, and that goes to kind of your question, Janelle, of how does that work? So again, it's kind of like getting the service approved and just laying in wait. And then when you're done with VR, so you're no longer getting that job coaching fee for service, that's when we can kick in and start providing that fee for service for job coaching.
And I'll just add, Janelle, that some CRPs are approved for DMH waiver funded employment services, and some aren't. And some of them that are approved from VR don't work with DMH. Some of them are DMH, don't work with VR. So sometimes they have to move to a different provider to get that long-term, what we would call that long-term follow-along services through the waiver, to visit them every month and provide that ongoing job coaching supports.
So are you talking, Amy, like a targeted case management provider?
No, but so yeah, it'd be a service provider. So some of the service providers that do VR support, VR funded supports, also do DMH employment supports. Or some of them only do DMH support. So some CRPs are actually DMH support providers as well. So they might have to move to a different support provider to have somebody following along with them.
I see. Okay. That makes more sense to me.
And I'm not sure if MERS is currently.
Yeah. MERS is.
But maybe not all the locations.
That's true. That's true. It kind of depends on the
Nels
area.
and Poplar Bluff.
But in Poplar Bluff, yes, I believe they are one of active service providers for DD. So yes, if they have somebody that is using VR that has waiver, then yes, we can request that supported employment. Just note that if they don't have a waiver, they could be in waitlist limbo.
Which somebody asked, do you have any idea of how long the wait list is?
So it's not, the way our wait list operates, it's more or less when funding comes available. So as we were mentioning, the legislators did not put funding in for caseload growth. So we're kind of looking at, unless something changes, this is how it's going to be until June 30th, 2025, at the very least. We don't know what's going to happen for the next fiscal year, and we won't know it until that budget gets finalized, probably in May of 2025. So now, once funding comes available, so let's say, the legislators find some more funding, or they release funds and they basically say, hey, we're going to go ahead and give you some caseload growth funds. So we get funds this year, or maybe in May, they decide they're going to put that on our budget. They're going to approve caseload growth funds. So we know come July 1st, we're going to have funds available. It's going to start with what are those highest priority needs. So again, we kind of use the MOS. The MOS not only does the functional limitations, but also generates that prioritization of need score. So we will look at who are the ones with the highest prioritization of need scores and who's been on there the longest. So it's kind of like the 2 points coming together. You have to have one of those highest prioritization and need scores. And then if you've been on the wait list all year, you're going to get first cracks before somebody who's only been on the wait list for 4 months with the same prioritization of need score. So that's kind of how that works.
So barring some sort of miracle or passing of some sort of extra bill, it could be a year at least.
Yeah, unfortunately. So Janelle, we kind of talked about one example where somebody's using VR and we're only thinking that they're going to need that ongoing long-term job coaching support once VR is done, once we've exhausted VR's supports. And we talked about how before we even exhaust VR, we can go ahead and request a handful of units so that we have that support already in place once VR goes to closed case and there's no hold the phone, wait, don't do anything, let's go get this approved quick, like that ever happens. So that's one example. Another example of where we possibly could be braiding funding. So how many times we've heard of individuals that go through VR, get a job, and then just a few months later, they're already singing, I hate this job. I really don't like this job. I don't want this job anymore. And a lot of times what we've heard back is kind of like, well, just stick it out just a little bit longer. Can't do anything just yet. And of course, what happens with those individuals? If they really want to lose the job, they're gonna lose the job. So this could be where it's like we could be using VR to continue supporting them in that new job that they hate, while then using waiver funding under the DD side to say, okay, let's help you find that next job so that you can gracefully bow out of this job and start the next job. That might be a better fit for you. So that's another example. Another example could be, we all know that individuals benefit from pre-vocational. Everybody does. Doesn't matter whether you have a disability or not. Everybody could benefit from pre-vocational services. However, pre-vocational services is not needed for everyone. But let's say you've got somebody that you're working with and you're going to go ahead and possibly move forward with job development, but you would feel a lot more secure if we had worked on some skills first. We had scaled up some of those workplace behaviors. And you would feel a lot more confident that the person would be ready. So while using VR for that discovery and exploration and even that job development, we can be under waiver funding, then doing pre-vocational services to help somebody be the best that they can be once you guys are able to successfully get them a job through VR's funding. So that's another example of how we can layer services and both be working together to help individuals succeed in employment.
Well, that's something new that you just shared with me at the end of your conversation. So I appreciate that.
Okay.
Do we have
Appreciate
any
the,
other?
oh, sorry, Amy.
Sorry, Janelle, go ahead.
Appreciate you further expanding upon that too.
You're welcome.
If anybody else with any questions while we have Sandy, the expert here.
This is Jessica. I have a quick question. Hey, Sandy.
Yeah.
So we've had individuals who they do have waiver funded services, but we hear that maybe we're supporting them and we're looking at maybe braiding some of that funding. But then we've heard in the past that maybe they don't have enough funding to cover, or they're using their waiver dollars for another service. Could you explain how that could potentially take place?
So I had mentioned earlier that the Partnership for Hope waiver has a hard cap of 15,000. So if somebody is using a lot of that funding under Partnership for Hope for, say, self-directed PA services, and now you're wanting to add some employment services, but with the addition of employment services, that's going to basically take them over that hard cap of 15,000. That's going to cost more than 15,000, which basically, you look at our current situation right now, it's like, okay, well, we could move you up to the community support waiver. Oh, wait a minute, wait list. So in that situation, that person could be met with, you've got a choice. You've either got to reduce some of that self-directed PA so that you can add employment services and keep moving forward with your Partnership for Hope waiver funding, or we can add you to the wait list for a community support waiver so that when funding comes available, maybe you can get a community support waiver slot and we can kick you up to that slot. Now you've got more money to then add employment services on top of your self-directed PA services.
Thanks, Sandy. So it's important to not just know that they have a waiver, but what kind of waiver, and if they're using their waiver for something else in those cases.
Yeah, which waiver? Yeah.
Thank you.
Hi, this is Jessica Platt from the St. Louis North office. So going off of what Jessica Block was talking about, do they often know what waiver they have?
So it might be the support coordinator has to help educate the family. So they just know they got waiver funding. They're not sure. When I did support coordination, a lot of my families did, but there was also a handful that probably didn't understand all the nuances between the different waivers.
Okay, thank you.
Mm-hmm. Bessie, I see your hand just went up. Go ahead. And if you're trying to talk, you're muted right now.
Hello, I have a question. As far as it's concerning the wait list. So do you guys monitor current clients maybe that are not utilizing and reaching out to see if they still need that waiver. And if they don't, do you guys look, or maybe even if the person's hasn't utilized it for some time, does it ever drop off and then that provides a slot for somebody else?
So good question, Bessie. Yes, we do monitor utilization of services because again, if somebody has been going a long period without utilizing any waiver funding, the next question is, well, do you really need that waiver slot or not? Now, there can be a multitude of reasons why someone is not utilizing funding. So it's not like hey, if you haven't used funding for a year, we're going to kick you out. It's going to be a discussion. We're going to kind of talk about things to kind of determine what needs to happen next. But more importantly, the thing to note here. So if somebody does drop out of a waiver, that waiver slot doesn't immediately become available. I want to say, I think it's about a year that we have to wait before we can kind of recycle that waiver slot. So there is a waiting period that we have to go through once that waiver slot has been terminated before it can be used again.
Okay, thank you.
Sorry about that. Frito had something to add. He's my big 80-pound. So
We have about 15 minutes left. If anybody else has any other questions.
So if nobody has a question, I will kind of pose one that was asked last week at the BCI transition conference to the panel that I was part of. So again, kind of talking about that wait list and what some have experienced as a result of the purse strings tightening. There was the question of, okay, so now are people having to go through VR before going, requesting waiver funding for employment services? So the thing that I want to point out here is that according to our service definitions, they haven't changed. So prior to funding getting tight, we always had it in our service definitions that if VR offered a comparable service, we had to explore that first. So when you look at our employment services, of the different employment services we offer, career planning, job development, and individual support employment have a comparable service over at VR. So if we're looking at wanting career planning for somebody, or if we're looking at needing job development for somebody, or even kind of that long, ongoing job coaching, we have to then go, okay, what about VR? Now, this does not mean we have to go open a case with VR and push VR for the proverbial denial that doesn't exist. But it does mean we might have to be having a conversation. We might have to pick up the phone, contact our local VR office and say, hey, I've got an individual over here that keeps telling me they want a job, but we're not sure that this person's really going to be successful. There's things that, are red flags for us that we've got some concerns about. And then, of course, that VR counselor is going to be like, so that you're going to have this dialogue between you and the VR counselor. And then at the result of that, then you might hear, well, you know what? Let's go ahead and try it. Send them on our way. We'll go ahead and do the intake. We'll move forward. Or we might hear, you know what? I really don't think at this time that we have anything that would really benefit the person. So we might hear from that VR counselor, not ready for us. I don't think we're going to be able to serve them. We can use that as justification of why we are requesting VR or why we are requesting waiver funding instead of VR. So if during that conversation it's determined that this person is not ready for VR, would not benefit from VR, document that conversation took place. So put that in the ISP. Hey, I spoke with Amy over at VR on such and such date. And per my conversation with her, she told me she didn't think Johnny was ready for VR services because, you know, Johnny's going to, you know, need line of sight supervision 100% of the time. We're not going to be able to fade supports. You know, he's got this anger management issue, which he's going to require a job coach there at all times, just in case, you know, he gets frustrated and decides to yell obscenities and get a little aggressive at the work site. You know, so again, you're going to document what it is, why it was determined that person was not ready for VR. That's going to provide that more information of, well, why is that not appropriate? Give me more. So
I will just add that's particularly in the case of individuals who are wanting to go into day hab services. They do not have to go through VR in order to go to day hab services. If they want to go to sheltered workshops sub minimum wage, then yes. If they're under the age of 25, they do have to go through us. But as Sandy says, we don't do that denial letter. So we just can have those conversations.
now kind of going on that, so that takes us down another rabbit hole. So again, Division of DD, we've had an employment first policy in place since 2011. This past year, 2023, the legislators passed an employment first provision. So Senate Bills 45, 90, and 106 basically kind of stipulated that all state agencies providing services and supports to individuals with developmental disabilities and or providing employment supports to individuals must adopt an employment first policy. So we are now truly an employment first state, not just an employment first division, employment first state. So going into that, so where Amy's talking is, again, as that employment first division, you know, basically one of the things that we would do is when people were requesting services and none of them employment services, but yet somebody was working age, we kind of go, well, what about work? Why aren't we also seeking some employment supports too? So that was kind of what was going on a little bit before. So when individuals were wanting just day hab and there was no employment in the mix, then those were kind of being pushed back a little bit on. Why aren't we doing any employment? Give us more information. So, and I think that's what was then causing support coordinators to feel like, okay, I have to go to VR to get a denial so that I can show, look, VR denied. That's why we're not doing any employment services and we're only doing day hab. But you don't have to do that.
Hey, this is Jessica Block again. I just wanted to add something. So Sandy, you had mentioned that, you know, somebody could reach out to VR and just because they're going to need 100% supports all of the time, that might be justification for them going to DMH supported employment. I will share, I know this is in our FAQs and our CRP agreement. If we have individuals that we are doing discovery and exploration or trial work and we believe they can work, and the only caveat is they're going to need 100% supports, that's something to involve that service coordinator in that conversation, because we can transition from 100% VR funded coaching to 100% DMH funded coaching. So it's going to take team collaboration to make that happen, but that is something that is possible. We just need to have all the team together to transition those supports seamlessly. So just
Love
keep that
you
in
added
mind.
that. I love that you added that, Jessica, because again, that example, so again, we see different things out of different pockets of the state. So in one part of the state, we might see a lot of those cases where if somebody's needing that line of sight supervision, that, you know, the VR office out of that geographical area is basically like, nope, we're not gonna do it. We're not going to move forward. If you're coming to me and you're telling me that they're needing line of sight supervision and that's never going to fade, we're done. They're not going to benefit from our services. But in other parts of the state, we might see some more willingness. Well, let's take a closer look at that. Let's see what that might look like. Because as Jessica mentioned, again, it's a deeper discussion. It's a deeper dive and looking into what does that look like. So a lot of times in the situations where we see, oh, they're going to require a lot of line of sight supervision, there's also the thought that it's going to take a long time to fade off of job coaching, that they're going to need 100% support for a long period of time, an extended period of time. So again, with that additional information, that could be the piece that is then causing that VR counselor to say, hey, we don't think they would benefit from VR. It may not be that line of sight supervision only, but it's that extended job coaching, and that it's not going to be faded for a number of years. So it's a good thing to have that discussion, have an in-depth discussion, really dig deep and dive into the why.
And have those continuing discussions on when does VR support end and when does DMH funding start? Like I said, we want it to be seamless, and so that's a lot of team collaboration.
And that's where, again, as I was mentioning with Janelle, that's where having that 480 units. So again, that's not a lot, folks. That's, if you think about it, that is 120 hours. So if somebody's working 20 hours a week, that's maybe only 6 weeks. So it's not a long period of time, but it's enough that can allow for that seamless transition where VR can close the case, and then you've got a little bit of time to put together an amendment to request additional support employment that the person really truly needs based on what we know about. Here's the task that they need help with. This is how often that they need, and so forth.
And just something else there, we just need to, like I said, work together and make sure that we're documenting, because we can't duplicate services. We can't both fund job coaching for the same dates. So we just have to make sure that we're verifying that these services are not occurring on the same dates.
And I think that a lot of that falls on the service providers. So knowing, again, where you're at, are you still getting that job coaching fee for service payment, or has that truly stopped? For support coordinators, I'm just going to bust a myth right here. That does not mean that VR has to close the case. A case could still be open because that service provider could be getting outcome payments, not the fee for service. And that's where it's like, a provider could be getting both a payment from VR and a payment from DD, but it not be considered duplicative. Again, that's kind of in the details. So I don't expect support coordinators to know all those details. Just know that VR doesn't have to close the case. But then you want to make sure that the service provider is clear on when to start billing DD versus when they are still billing VR.
Yeah, VR may even be funding something else that the client needs that is not coaching at that time to make sure they can maintain their job. So
yeah,
great distinction. We are right pushing up to our time. Sandy, people are asking if they can get a copy of the PowerPoint.
No, it's a well-kept secret. Yeah, I'll go ahead and send it to you. Just note, I want to give credit. So I didn't mention her by name, but you'll see her name on the PowerPoint. So that TCM service provider, that support coordinator, supervisor that collaborated with me for that presentation last year, and we're doing it again this year. You'll see her name on the PowerPoint. So just making sure I give her credit.
And everybody who has put their email in this chat, I have you down so far, so I will send it all to you. I'm not sure if this will send me an attendance sheet. If so, I will send it to everybody after Sandy sends it to me. But if for some reason you don't get it from me, email me. My name should be in the thing.
Quick question, I'm sorry. Is job retention up under VR?
I'm just getting a million emails in my thing now. So we follow along after the client is done with coaching for 90 days. And then we're paying the provider for that. And then usually funding for that switches over to our SB 40 boards, or the local provider, or sometimes DMH funds for that long-term forever supports. Does that answer your question, Ms. Hall?
Yeah, I was just trying to figure out how this works.
You can always call me.
Okay, I will.
Okay. All right. Well, thank you so much, Sandy. You may get some people emailing you, asking you questions after this. I'm going to get everybody's emails down here so I can get this sent out after you sent it to me. Everybody, I hope you can join us next week. We have guest speakers from the Independent Center and NAMI to learn more about their resources and some success stories. So we hope you'll join us next Tuesday at 2 o'clock for our next event of Transition Tuesdays. But thank you, Sandy.
Oh, my pleasure. And my email is on the PowerPoint, so feel free to reach out to me with any questions, folks.
All right. Thanks, everybody.
Thanks.
Thank you.